Hi, everybody. Melissa Steck here from the Christian Reformed Church Office of Social Justice. I'm one of the Justice Mobilization Specialists for our team, and I'm here with a few guests from World Relief. I will allow them to introduce themselves in a little bit, but just to give you a little introduction, we are making this video looking forward to World Refugee Day, which is coming up on June 20th, and that's a special day for us to celebrate and remember our refugee neighbors among us. And in the US, that also includes asylum seekers. So to help you celebrate that day, we wanted to put together these videos in hopes that you will use them with your congregations to help update your faith communities about the impacts of COVID-19 on immigrant communities, particularly asylum seekers, refugees, and undocumented communities. And also to talk about how your church, how your community can respond and be supportive. So in this first video, we will talk about the impacts, and the second video, we'll talk about what you can do to help. So to say a little bit more about the Office of Social Justice, we are a ministry of the Christian Reformed Church, and with our immigration work, we are here to help equip churches to do justice for and with our immigrant neighbors. And that looks like working with you to provide resources in terms of worship, education, relationship building, and advocacy. So we hope these videos will be supportive towards those ends with your faith communities. So, and we are joined here, as I mentioned, by some guests from World Relief, Peter and Angelica, and I'll allow them to introduce themselves and the work of World Relief. So we'll introduce you first, Angelica.
Yes, thank you, Melissa, and thank you everybody for taking the time to watch these videos. My name is Angelica Barahona, and I work from the Chicago office of World Relief. I'm the program manager for the Asylum Project, and in this program, we serve uniquely asylum seekers, people in the process of obtaining their asylum relief, and we provide case management. So we help assess what are some of the special needs that families have, and then kind of help them build a plan to how to fulfill those needs in order for them to become what we call more self-sufficient, that is, that they're more independent and more capable to feel able to advocate for themselves and get resettled in the country.
And I am Peter Zigterman. I'm the Director of Immigrant Family Services in World Relief Chicago location. We provide social services to refugee and immigrant families. We have case management, which entails much of what Angelica described. And we provide that for refugees and really immigrants of any kind. We also provide employment services and school support assistance and different youth mentoring options. I also do a little bit of advocacy work on immigration issues for the Office of Social Justice as well.
Great, thanks for the introductions, and so grateful for this partnership. So just a couple housekeeping things, or well, just one housekeeping thing before we dive into our questions. We're going to be bringing up throughout this conversation some links, some ideas for resources, both in this video and the next video. So just related to those resources that are mentioned here, they will be available in the video description. So look there for any resources that come up in the course of our conversation. So again, thanks again for joining us, and a few questions to help us understand the impacts of COVID on immigrant communities. So my first question is for Peter. Could you tell us about how immigrant communities, especially resettled refugees, have been impacted by the coronavirus pandemic?
Yeah, thank you. Immigrant communities, I think, have been hit particularly hard, and I would say even especially in big city contexts like the one we work in Chicago. Many of the refugees we work with work in hospitality industries and service industries like hotels and restaurants downtown Chicago. And many of them, due to that, have either lost their job and have been furloughed. Refugees, if they've are recent arrivals, they won't have the work history necessary to qualify for unemployment benefits. That won't be an option to them. And also won't be able to immediately access the $1,200 stimulus check that so many of us received, just because they won't have been here long enough to qualify. Additionally, as I'm sure most people watching this have seen in the news, right, we know the unemployment benefits only work if you can access them. If your application gets processed, if it goes through, and we've certainly found while that works for some, there's hitches and snags for others, just due to the massive amount of people trying to access that system at the same time. So yeah, it's a community that's economically been hit particularly hard. Also from a health standpoint, the Rogers Park West Ridge area of Chicago is one of the areas in which a large number of refugee families end up living, and that's been one of the harder hit areas by the coronavirus pandemic. So they've taken from a health perspective, also have had a disproportionate toll taken on them as compared to Chicago in general.
Yeah, that is so challenging. So many layers of disadvantages that are compounded by this situation. Absolutely. So Angelica, could you tell us a bit about how these impacts of coronavirus are impacting asylum seekers, asylum seeking communities?
Yeah, thank you, Melissa. I would say the problems listed by Peter are also pretty common among asylum seekers, but also there's other problems that come with the fact that many of these families are still in the process of obtaining immigration relief. The main burden for many has been losing immigration appointments. It's still very unclear what will happen for all the families that lost their appointments between March and July. That's the period that all immigration offices were closed, so hearings were postponed. And if you know enough about the process here in the United States, it's very slow. So for someone who had a court hearing, was waiting probably at least a year to be seen by a judge, now their hearing is canceled and there's no date in the future. That carries not only an actual problem with your paperwork and the delay in your case and when you will be eligible for employment, but also carries a burden of anxiety and stress. There's a lot of other related problems with re-traumatization for asylum seekers, because a lot of what we see with stay-at-home orders and curfews is just really stressful. I had a lot of different conversations with asylum seekers. We're very afraid about what it means that police will be outside. Like, would I be imprisoned if I go to the grocery? So a lot of confusion. And when we add to this a language barrier that is common with refugees, but even more so with asylum seekers, because the fact that many of them have been in the country for a little amount of time, and there's not a lot of orientation to the culture that is mandated for asylum seekers, as refugees come with a grounding support of an agency. Some asylum seekers don't have that for the most part. So a lot of these things just cause a lot of pressure, and there's a lot of misinformation in the community. So I think problems get heightened too. And other neighborhoods, at least in Chicago, that where a lot of asylum seekers live, like Little Village and Belmont Cragen, have been in the top 5 of the hit by COVID. So all of that kind of maximize itself. And one last issue I think is important to be aware of, because I think the church can do a lot on this, is e-learning. For many of asylum seekers and refugees, e-learning is a complete foreign thing, and many families don't even have the access to technology. So if the school district is not proactive in reaching to the families, in making sure they have interpretation, many families get left behind in their education. And even when parents have a good desire to help their children get the e-learning, if they don't have the English, they don't have the technological means, they don't have Wi-Fi in the home, it gets increasingly challenging. So I think those are some of the main ways that families are just feeling the pressure at this time.
Yeah.
Can I add? I was just gonna say, I think that's a really great point you bring up, Angelica, about just the dissemination of information and the challenge that is. I think you think of what all of us are going through, as even with English being our first language, keeping up with the news and the different regulations that various state and local governments are putting out in terms of what COVID-19 means in this particular time, and where we can go and where we can't, and where we need to wear a mask. And then you think about making sense of all that if English is not your first language, if you don't speak it well at all, if you don't know that many people who can explain it to you. And I think World Relief organizationally, we have 3 offices in the Chicagoland area, all in 3 different counties, and we've collectively done a lot of work in trying to figure out what's the messages we need to make sure the refugees and immigrants we're serving get. How do we effectively communicate that? How do we try and provide as much clarity and as little confusion? And I think that's a great point to bring up, Angelica, how difficult that is, and that we probably take for granted if we just speak English.
Yeah, absolutely. And I meant to do this even before posing these questions to both of you, but to help folks be given a bit more context with refugees and asylum seekers, they are folks that may have had similar experiences of fleeing violence and persecution, but the difference is that refugees were processed overseas and come to the country already with their papers. And asylum seekers have come to the border, to a port of entry without those papers yet. And they are seeking to go through the process to be able to obtain that protection, similar to what refugees have. So obviously some of the layers that Angelica was describing are not only the ones that Peter described, but the additional ones of navigating our U.S. Immigration system during this time when things are shut down, and in many ways our asylum system has been compromised in recent years. So there's, lots of layers of challenges. So speaking of challenging systems, I wanted to ask both of you, or whoever is wanting to answer, if you could talk about the impacts of COVID-19 on undocumented communities. So immigrants among us that do not have paperwork, do not have a pathway to citizenship among us.
Well, I can start, I guess. I think if you just on the very basic level, I mentioned earlier about how some refugees don't have access to the stimulus money in the CARES Act, or unemployment benefits, or other benefits due to how recently they've arrived or whatever. The undocumented population has no access to any of that type of federal assistance, any type of assistance in that sense, and it's a time in which help is most needed, yet at the same time the lack of recognized status makes them more afraid of asking for the very help and assistance that is necessary for sustaining life. And there's just I think we have seen a tremendous amount of need that exists in our communities. And if we're looking for a silver lining, I think a tremendous opportunity for the church to come alongside and show our neighbors and our community members this is what the church does. This is what Jesus looks like. This is what the love of God looks like. But just tremendous amounts of need, tremendous amount of fear of how rent is going to be paid, how food will be put on the table.
Yeah, definitely. That is something we see across all of our undocumented families that we work with. Also, I think it's very important for many of us to remember that the fact that many of these undocumented folks are around us doesn't mean they don't have jobs. So many of them actually do work, find some source of employment. But when things like this hit, they're the first ones in getting fired because they're not, in many cases, registered as a regular employee. So it's easier for many businesses to, many ways, get them out. And there's no obligations of when they're going to come back to work, compensations. Some of families that have come to us, they just simply said, they told me not to come back and I can't do anything about it. And I can't apply to any other source of income. And many undocumented families also are living on the paycheck. So when you take that away, there's no other way. What happens with many of these families that they go out trying to find a way to make an income because they know that's the only way to support themselves, and that then brings a higher exposure to the virus. And again, some of the neighborhoods that at least we see in the city of Chicago have the highest amount of people affected by COVID are the same communities that have the higher amount of undocumented families. And that is a very sad reality. And many of these folks also, because they don't have the proper documentation, they don't have medical coverage. So I have spoken with families that said, I think we got the virus, but we didn't do anything about it. We just stayed home and we do natural remedies. We waited, or we just had to keep working because we don't know. So we just prayed it was a flu and couldn't access other services. And of course, the city is trying to do things like free COVID testing, and you can have emergency Medicaid, but some of these things are not clear. And with the climate of fear and the climate of rejection, especially put on undocumented folks, there is this increased fear that what if I go to the doctor and then I'm going to be deported? What if I go get a COVID test and they ask me for a paper? I don't have it. And some of these things are not really what happens when you go to a COVID testing. They might not ask you for what's your proper employment authorization. It's just the fact that there has to be some showing of your status that gets really threatening. And kind of to echo Peter's answer, I think this is where the church can really come alongside and say, we are a safe space. You don't need to show us papers or explain why you stayed undocumented in this country to receive support from us. We are going to show you the love of Christ in tangible ways, because this is what we are called to do. In the Bible, we're compelled by love, not compelled by your paperwork. So I think this is a great opportunity for the church. And I will lastly say there's also, I heard from many stories, there's higher discrimination too. I'm feeling like they are not well seen in their communities, or they might be seen as a risk factor in all these situations. So I think it's just something to be aware of.
And then Angelica's response made me think of two other things regarding this, is that as we're talking to families and hearing stories about what jobs, for example, an undocumented family may have lost, I'm not going to on video say the name of the restaurant establishments, but as most are aware, restaurant workers, that's a high percentage of their workforce often comes from undocumented immigrants. I would say it's fair to say many of the restaurants we love and enjoy are benefiting and enjoying the labor they are receiving from our undocumented neighbors and community members, which is something to keep in mind. And I didn't even mention this earlier, but most people have probably seen on the news one of the highest places for contracting COVID, for example, has been like meat processing plants. those tend to be stacked by their workforce tends to be a high percentage immigrants, a high percentage of their workforce, which again is just another example of the particular vulnerability that these communities are facing. So thank you.
Yeah, absolutely. Yeah, thanks for bringing that up. And it's actually one of a member of one of our immigration mobilizing team that has been involved in Northwest Iowa in one of those situations where there's been significant COVID outbreaks and in those meatpacking plants, and it's really impacting the immigrant refugee communities there. So yeah, thank you for shedding light on that. Yeah, thank you to both of you for giving us an idea of how these impacts are being felt in these different immigrant communities. So we'll use that to sort of wrap up this conversation for this video. And don't let your engagement stop there, because we want those that are watching and engaging in this conversation to now have an idea of what to do next. What do we do now that we know about the impacts of COVID on asylum seekers, refugees, and undocumented immigrants among us? So join us for our next video and learn what you can do.
Thank you.